Hello everyone, thank you for joining us tonight for this webinar titled Fundamental Asepsis Rules to protect you, your staff and your patients. My name is Christian Stempf, Hygiene Adviser to the WNet Group. I've been with WNet for almost 30 years. I had the chance to co-design a steam sterilizer and educate around the world. I'm also a member, as you can see here, I'm also a member of the European Committee for Normalization. This is very important because we participate to two projects, or let's say we follow two standards. This one concerns steam sterilizers and this one concerns thermal washer disinfectors. So I've split the presentation of today in two parts. The first part will be, especially after or during this terrible pandemic, to protect yourselves, And the second is pre-surgery or pre-treatment, pre-dentistry. And then the second is post-treatment, once the patient left the dental chair. So we've planned about 50 minutes and there's room for questions. I will manage to see the chat on YouTube if I can, otherwise my colleagues will help me in this sense. So we heard a lot at television in the last weeks, good things, bad things. I just want to highlight and prove with some studies what was said and especially the big concern. You have noted that now we have to wear masks where many people get together and shopping malls and so on. And there's a good reason for this. I mean, we have to realize that every individual, every person releases from 100 to 5,000 microorganisms per minute. Can you imagine this? From what does it come? It comes from, skeins. These are nails, hair. We release particles. This shows you the number of particles, depending if you're on standstill or if you are, moving fast. You will also, distribute a lot of these particles, and every particle contains something, contains microorganisms. It comes from nasopharyngeal droplets when we talk, when we cough, when we sneeze. And I've seen this program on NHK Japan. It is really fantastic because, well, fantastic, scaring, but very interesting. So you see in this zoom, there are big droplets, about the size of 1 millimeter. These droplets will drop immediately, but the smaller ones you can see here, around 0.1, 0.3 micron, they will stay in the air, they will fly around, and they will contaminate the environment. We call this environmental contamination. You see all these small particles which are suspended in the air and infectious in most of the cases. Now, this second video will show you two people chatting. So they talk loud. So you can also see some, particles, some droplets flying around. This is a case with many people. One guy is coughing, and you can see the particles. Then the air condition or people moving, also talking, breathing, this will distribute the contamination around the room. After 20 minutes, this is how it looks like. So I think this is very important to illustrate the contamination. Now, talking about air condition. This shows you with a medium-low speed that the particles, the heavy ones like the 1 millimeter droplet, will drop extremely fast, but some ones they will travel up to 100 meters, depending on the mass and the weight and the size of this very small particle. I mean, these particles, we cannot see them. It's 0.1, 0.3 micron. So this being said, in a shopping mall where many people are together, you can count on about 4 million microorganisms per cubic meter. This is why we wear masks, and we'll see later the type of masks we should wear. If you watch on the street, it's 88,000. At the beach, in the forest, it's far lower. So in these places, it's nice to do our sport and jogging. It's really safe, a lower risk to get infected. This is in a dental practice. It's around 1,500 per cubic meter of air. This is like 2 or 3 people chatting in a room. That's the normal contamination. What about the patients? You know, the patients come into your office. You don't know the state of health. This maybe is not the nicest looking patient, but maybe this person looks after himself, he's really safe. And maybe this one, oh, that's me. Maybe I'm the infected guy. So you should, treat every patient as a patient at risk. So there's no difference between your kids, your grandmom, or your neighbors, or any patient. Every patient should be treated as a patient at risk. On average, 1 person in 20 has something. Okay, if you have 20 patients a day, 1 is infected, potentially infected, and infectious. So this person could infect you and your staff. How can you get infected? Or how can you infect your patients? We talk here about transmission modes. There are, let's say, 4 ways. The first, we just talked about this, comes from splatter or aerosol. Aerosol are these 1 to 3 little droplets, invisible, you can't see them. This is called aerosol. This is the air that you breathe in front of your patient. I mean, it's a distance of half a meter, sometimes less, 30 centimeters if you watch deeply in the mouth. So this is really, you are really a dentist. Believe me, you are really exposed to a big risk. Healthcare professionals, you are the ones, really the ones, the most exposed to a risk. It can also come from your dental unit. If your unit is not maintained properly, I'm talking now about the compressed air, the compressor, and then all the tubes, the pipes that bring air to your handpiece, especially water, cooling water, will travel along the unit. And inside the unit, if you switch it off for 1 weekend, for 1 week, be full of microorganisms. So the nice thing to do in the morning, you just flush for half a minute, 30 seconds. You let it run and flush to drain, to purge your lines, water and air lines. This is important. It's something you can do. It doesn't cost much. It costs nothing actually. Third way is a direct contact. This is blood-to-blood contact. If you are injured and you are in contact with someone else's blood, you have a direct infection from blood to blood. Or it can be saliva or any body fluid, okay, contains blood particles. And then, unfortunately, if the instruments are not sterilized, are not reprocessed well, you don't treat your patients with safe instruments, especially the handpieces. Last but not least, hands. I mean, hands participate to a big portion of diffusing contaminants around the chair. You touch everything with your hands. If you watch here, this is the contamination of 1 person who have contaminated this hand, and this person checked hands. 1 person, 2 persons, 3, 4. The last person, you see, still had some residues of the initial contamination. Now imagine if you shake 50 hands a day, you don't wash your hands, and put your hands towards your face, you touch your mouth, you can infect yourselves. This is how the coronavirus has spread so quickly. Okay, people, this is really infectious. If it was not enough, I want to show this study from the UK, where 2 sampling units were put very close to the patient's mouth, 1 meter, and around the bottom of the chair, around the legs. And this shows, you see, and the right picture shows, during treatment, the turbine runs with compressed air. So you will compress or pressurize the patient's mouth. In a patient's mouth, or any mouth, you have around 10 billion microorganisms. So these, again, droplets, aerosol, will travel towards your face. And here, at 1 meter, they measured around 4 times more, 4 times higher contamination. After the treatment, it drops. As we saw before, the aerosol, the particles will travel and settle. Second patient, third patient. So treatments like scaling, drilling will contaminate the area of your chair, and this is the air that you breathe. Okay, this is there's a lot on internet. You can check here. The fact that drilling exposes you to up to 2 meters, and that also microorganisms can survive on any surface for several weeks or months, depending on the type. And these are the so-called airborne disease infections: COVID-19, TB, pneumonia, influenza, coughs, and colds. All these microorganisms will affect your respiratory system, your lungs. So this is a good reason for wearing a mask. Now, recently I lectured on masks. I saw a lot of clicks coming from Indonesia, which was very nice. And there are 2 types of masks. Now, this is very important to listen, because I think you are going to change your mind. So did I change mine and my understanding on masks. Yeah, this European norm, European norm. This is called a surgical mask. 1-2, 1R, 2R. Basically, this is a mask which is designed to protect your patient, because it will stop any microorganisms from the air you're exhaling. Okay, what leaves your mouth as a doctor towards the patient. It's a one way. If you breathe in, okay, you might have the R. This is the 1R or 2R. This is the especially plus as a fluid resistant mask. So it will stop some splatters, some splashes, saliva coming from the patient's mouth, but it will not stop particles below 5 micrometer. And you saw before in the video, we talk about 0.1 to 0.3 microns. So the air that you inhale is not going to be safe for you. Now, I forgot to tell you, I'm French. In my country, now dentists who understand this, it was really repeated every day at the news. They switch now to a different type of mask because they do not provide a complete protection. So which are the appropriate masks? Here we go. We call them the FFP, protect against particle. And these masks offer a filtration of airborne particles below 5 micron. It can be 0.1, 0.3 micron. So that's very nice to protect yourselves. and from inhaling any infectious agents, especially the coronavirus. It will stop it. Now there are three types: FFP1, I forget about this one, FFP2, FFP3. FFP2, which is also called N95 or KN95 in China, well, these retain 95%. This FFP2 retains at least percent. The difference is 1%. Obviously, I've gone through some studies, and some FFP2 masks, they filter up to 97-98%. If you go beyond 99, then it becomes FFP3 mask or KN99. They filter 99%. Of course, breathing is harder. They're not so comfortable unless you wear an exhalation valve. These masks are available with exhalation valves, which is nice, easy to breathe. It creates less moisture inside the mask, but there's a but. It does not filter the air that you exhale. So if you are infected, you may infect your patients. So I would recommend to use FFP2 masks without exhalation valves. Maybe they cost a bit less. I have no idea about the price. Good. Hand hygiene. This is very important. I mentioned that hands are responsible of disseminating contaminants. So it's important when you remove your gloves to not automatically wash your hands, because inside gloves your hands are not dirty. So what you do, you should disinfect your hands, because inside your gloves, it's moist, it is hot, so bacteria will colonize, will multiply. So the longer you wear your gloves, the higher the contamination. So when you remove the gloves, the first thing to do is not wash your hands, but disinfect your hands with the hydroalcoholic solution. And you will because maybe you have touched some instruments, and you will re-disinfect before you put a new pair of gloves. And obviously before and after you manipulate masks, you should also disinfect your hands. Don't touch the mask from the front, but grab these small elastic cords. I forgot to mention also before, sorry, surgical masks can be worn for 4 hours. 4 hours without removing it from your mouth, without touching the filtration part, without putting it on your neck. So you should not touch it, and you can keep it for 4 hours. For the FFP2, it goes from 6 to 8 hours, again without touching. So you will keep it all day long without touching your masks. 6 to 8 hours to be checked with your supplier. You wash your hands, obviously, first thing in the morning, after the toilets, after lunch, whenever they are dirty. Otherwise, don't wash too often, you will damage your hands. Okay, you will remove the natural protection we have on our hands, which protects us, our skin. Pre-surgery. I think better than talking a lot, I'll show you this visit to a well-known doctor in my area. I think it's one of the top implantologists, and I think once I've spent my day there, I understand why he's one of the top. So you see, the first thing when you enter, you see this beautiful lady, hello, and in the back you can see they show the reprocessing area. They show there's a sterilizer here, there have been 2 sterilizers. There's a washer here. You are safe because we care. This is really something you must show to your patients. Yes, it's you advertise, you practice, you advertise that you do things properly according to standards and according to well-defined and applied protocols. Then the patient travels to the changing room. Here we have sliding doors. They don't touch anything. And we walked by again on the reprocessing area, which was here on the left. The first door was the so-called dirty area where you do the soaking and washing. And then the second door was the clean area. In between, there's a small window to allow the cleaned instruments to travel to the packaging and sterilization area, the clean area. So again, the person could see the autoclave, the washer, and be sure that the assistant will advertise, if I may say so, advertise this. Now, every night they will, let's say, sterilize the room, the operating room, and they use nowadays a lot of these machines in use to disinfect buses, airplanes, hospitals. There's a lead time. I called my friend. There's a lead time of 8 weeks now to get such a machine. I don't know if you can get it in your country, but this machine will spray hydrogen peroxide, which is a very nice killer. It is bactericidal and sporicidal. I mean, endospores are the most resistant, difficult to kill microorganisms. Even a sterilizer must work be 116 degrees Celsius to kill spores. Do you imagine this device can do it within a couple hours? So basically, you give information to the device, the size of the room, 40, 50 cubic meters, and the machine will automatically dose the product needed to disinfect the room. You press the delayed start button and then you leave the room and you go home. This machine works for a couple hours. What is nice, there is no chemical residue, it doesn't damage any Dell units, even keyboards from computers will not be damaged. So for this doctor, Dr. Thomas, he does it every night. And when he comes in the morning, he feels really safe practicing in his theater. Now, during the day, that's also something which people sell a lot nowadays, is a so-called HEPA filtration system. HEPA stands for high particle filtration. It basically recycles the air, okay, you have an airflow, and it will trap particles which are above 0.3 micron. So it will trap all the contaminants, all the part of aerosol will be trapped in this HEPA filter. So it will keep the environmental contamination quite low. I saw this device, which is really interesting because it reminds me to high-tech hospital operating theaters. They have a guided airflow, and this guided airflow will somehow blow off or away what comes out from the patient's mouth. So you are just, insulated, cut from the patient's mouth. I think this is something very interesting. It also features a HEPA filter, so it filters and blows air, preventing any aerosol from being breathed or getting onto your mask. This person wears a surgical mask, by the way. Good, then before every patient, this is the filtered water. They use very neutral pH soap and sterilized brushes. So we've done some trials and noted the video is not ideal, so I apologize for that if it's a bit slow. I stopped talking so the stream might be better. So see, this is a surgical hand washing down to the elbows. She does it twice. This is the assistant. Very important. She does rinse from the fingertips towards the elbow. If you do it the opposite way, you will bring all the contaminants towards your fingers. This is the right way to do it. Now she will brush her nails and wash again second time her hands. Obviously, between patients, she will remove gloves, disinfect hands, and put a new pair of gloves. She will not wash like this, otherwise you just damage your skin. Huh? It's too much. Okay, let me save some time and skipping this. This is the boss preparing himself. He's not allowed to touch his belt, so that's a small mistake, because he had not yet disinfected his hands, so he should not touch anything prior to disinfecting his hands and putting his surgical gloves. Here we go. And I want to show that even the best do mistakes. See, the mask, which is not FFP but a surgical mask, is not properly applied to the assistant's mouth. So basically, air flows through the less resistant ways. So air will flow, non-filtered air will be breathed in by this assistant. So you should put this strip above the ear, like the doctor. One on top and one below, and don't cross these strips here. Okay, this is the right way. So they use a kit, a single-use disposable kit, which includes drapes and covers. So she will prepare the operating technical table. You will note that she has not yet put her gloves. Why? Because she touches the packaging. And inside it is sterile, but outside the packaging it is not sterile. So you must touch this before you put your sterile gloves. You will note that she does not touch any part from inside. So she will carefully even drop the instruments onto the table. She will now, place the cassette. Here you go. Here she drops the implant out of the first protection. And only once this has been finished, she will disinfect her hands and put sterile gloves. There's a special procedure to put your gloves without touching the area of the hand and finger. It would be too long to show. And now she can touch the sterile instruments and organize them according to the doctor's habits or wishes. Here you go. The patient is covered. Okay, it looks maybe too much, but don't forget that people pollute the environment. So even the patient is bringing microorganisms into this room. This is why she was a lady. She was dressed up and covered to avoid any, flying around, if I can say so, microorganisms. This is the surgical unit which was covered, like the X-ray, the lighting. In front, there was here the screen, so I can see the case. And every label from the sterilized items, you can see here it says Nobel, this is the cassette, a cup, all the instruments used. Everything is collected, sticked on this paper, which has to be signed by the patient. Look at the implant, the batch number, the stitching, wires, everything is recorded in case of dispute. Nowadays, when people pay a lot, they will sue you if something is not done properly, if there's an infection. Post-treatment. After the treatment, we have to reprocess all the used and non-used instruments. Okay, don't think, oh, this is not, we have not used it, we can use it again. No, because as you understood, around the chair, everything is contaminated. Even non-used instruments are contaminated. So you need to process them. This is a virtual reprocessing area. As I mentioned before, this is the virtual dirty area and the clean area. This is just to show you that ideal would be to travel from left to right, okay, in and out. I know it's not always possible, it's always too tight, too small, and we do this in the same area. It's a pity because in this area, as you are brushing, cleaning, transporting instruments, the environmental contamination is much higher than in this area. Okay, usually the airflow for ventilation or air conditioning should flow from the clean area to the dirty area, the opposite way. This was not my topic. My topic was to show you the steps. The first step is soaking pre-disinfection, rinsing, cleaning, rinsing, drying, packaging, sterilization, and storage. So I just want to add that I will send a copy of this presentation to our partner, Cobra, and you might ask for some slides or a presentation. There is no secret. We share everything. It will take 3 hours to explain everything, but I want to focus on the main aspects, the main steps. This is quite urgent. All the instruments, used and non-used, I repeat myself, must be plunged inside a solution. I'm not talking about the handpieces, okay? You cannot soak handpieces, you must wipe off handpieces. This is one of the limitations and headache with handpieces, you cannot soak them. Why is it so urgent? Actually, the first purpose is to prevent debris, blood, saliva, or any remains from drying. If you let it dry for during lunchtime by saying bye-bye to the patient, it's going to be dry, and believe me, it's very quick. I mean, blood can dry within 10, 15, 20 minutes. It's very fast. If you let it dry, it will be difficult to clean afterwards. Second thing, inside these debris and stains, remains, tissues, bacteria will continue to grow. So if you think that every half an hour you will double the number of microorganisms on your instruments. So you may even compromise sterilization. If there are too many microorganisms, it's going to be impossible to sterilize. I know it sounds strange, but now the very good reason for this is not here. We don't want only to stop the growth. We want to start killing. Okay, we talk about the log of 5, a reduction of 10 to minus 5, so 100,000 times the population of microorganisms. And by doing so, it is also safer for your staff, because after this you're going to transport, manipulate, clean, maybe manually clean the instruments. So you put your personnel at risk if you don't do this properly. After this, it's important to buy the appropriate solution. A solution is always water plus a disinfectant. Here, this is the expected level of disinfection. It's called intermediate level of disinfection. So what you're going to purchase must satisfy this, the scope must satisfy this. It must inactivate enveloped viruses. This is the coronavirus. They are quite fragile, but still we have to buy the appropriate liquid. Then we talk about bacteria, fungi, yeast, non-enveloped viruses, up to the multi-resistant bacteria. And here we talk about the tuberculosis Mycobacterium. It's a very resistant bacteria. So which is the appropriate solution? The best is you talk to your distributor. You have to select the right combination. This shows the concentration. You can put 1, 2, 3, up to 5%, depending on your choice. 3%, for example, means 30 ml of disinfectant and 970 ml of water. Together it makes 1 liter. What do you expect? Virucidal, bactericidal, and multi-resistant bactericidal. It's also called tuberculocidal. Now, if I watch here, I select 3% with 15 minutes I'm okay on viruses because it says 1% 15 minutes. So here I believe it's going to be faster. It's not mentioned, but this also shows that it's not always easy to understand. But here I'm not good in multi-resistant bacteria. So you either increase your contact time, your soaking time, to 30 minutes, or you spend a bit more, you go to 4%, cost a bit more, but you reduce by half the soaking time. Okay, once you get this slide, then you can study and then remember what I just said. But any mistake here will compromise this first very important crucial step. Then you rinse and then you clean. Cleaning is fundamental. In many guidelines it says only clean instruments can be sterilized or sterile. And therefore here we don't need a disinfectant, we need a detergent, totally different properties, because detergent have cleaning properties. It goes from wetting and foaming. It will nicely wet, humidify, distribute the detergent onto the surface of your instruments. It will emulsify, so it will remove stains, debris, dirt from the surface and prevent that this comes back onto the surface. So it's called dispersant. What about enzymes? We have enzymatic detergent or cleaning solutions. Enzymes don't kill. Okay, this is something you have to understand. In some countries, for the first step of pre-disinfection, I read a big mistake because it says you should soak in an enzymatic solution. Enzymes do not kill. So here we don't want to clean, we want to kill. Here we want to clean. So we need enzymes to improve cleaning, because enzymes will help eliminating the biofilm. Basically, it will cut all the removed debris and stains into water-soluble residues. It's absolutely not dangerous. It will go through your sink and it will degrade afterwards. So it's very nice to use enzymatic, not to say 3 enzymatic solutions. You have solutions with 3 types of enzymes, specific enzymes for specific fats or soils. So someone has to brush, okay, someone has to provide the mechanical action. This is the problem. If you do it manually, it's quite dangerous. You see this lady, she's dressed up like an astronaut, heavy duty gloves. She has a surgical mask, which is okay for splatters. In this case, it will be okay. But also maybe some dentists will ask their assistant to wear a FFP2 mask and obviously a face shield. You might get some droplets into your eyes and get your eyes infected. We never talk about this, but any aerosol or droplets on your eyes is infectious. I'm not sure, but I think you can catch the coronavirus through your eyes, your tears. It's a body fluid, so it will be inside your body and you can get infected. I'm running a bit late, so I will speed up, but I think you know these things. Use soft brushes to prevent scratches onto the surface of your instruments. Now this is better, much better. It's ultrasonic cleaner. So inside this chamber, we have a solution, this enzymatic solution, and below you have 2, 4, 6 bigger. The bigger the chamber is, the more transducers. And these transducers will create the noise. It's a terrible noise. It will create compression and decompression. Okay, try to move your hand in water. You can see small bubbles. So this is decompression. It will generate small bubbles which will implode. So they will, as shown in this video. No video, sorry. There was a video showing the effect of ultrasonic cleaner, which disappeared. I apologize for that. But this is the second best cleaning method. And in future, and hopefully we can reduce the prices, this is the best solution. Thermal washer disinfectors. yes, they are expensive, but they do the pre-wash, rinse, wash, rinse, and dry. Because drying is also very important before you package and you sterilize. So we offer two types of machines. T-On Plus offers a better drying with closed door. There's a hot air, ventilation and drying system. So manual, ultrasonic, and washer. So I ask you at least to use an ultrasonic cleaner. Then rinse and dry properly. Dry, it's nice to use compressed air, because if you realize many of your instruments have hinges, have lumen hollow, which can hardly be dried unless you use filtered compressed air to blow out water. And then you dry the surface with a single-use non-woven tissue. Non-woven, it's not cotton, it's not paper. They are fibers which are bounded together by a chemical or mechanical system and heat. So they will not release any particles, dust, like paper would do or cotton would do. So single use, very nice to use. Packaging. If you want to store your instruments, if you want to keep them sterile to the point of use, so you open the pouch in front of your patients. I believe that your patients are going to be tough in future. They're going to ask you about safety measures. I see even here at the how do you call it? Where you get your hair cut, and the barber, they will ask, what is your prevention measure to prevent any problem? So I guess dentists are going to be really questioned a lot. These are welding devices, nothing to explain here. If you have single-use pouches, it's fine to me, but you will have to do a test before you reuse them. Please fill them with water and 1/3. Then you glue your pouch and you put it upside down. If you see water pouring out, this means that it's not sealed properly. So it's not going to be maintained. The instruments are not going to be maintained sterile inside the pouch. Two reasons: either the pouch is not of good quality, or you have not folded it properly. You have inside here you have a strip, a mark that shows you where to fold the pouches. Now we come to the last but very important phase: sterilization. This is the blah blah blah. Okay, it must be a method that guarantees the removal, the killing of all microorganisms, including spores. You remember I talked about bacterial endospores, the most resistant microorganisms. They must be killed there. The acceptance, because despite what we may think, it's never going to be 100% sterile. I mean, there's a tolerance. This is the European standard for sterilization. It says that the survival of microorganisms can be expressed to a probability reduced to a very low number. It can never be reduced to zero. What does this mean? And this is the meaning for SAL 10 to -6. It says sterilization or safety assurance level of 1 in a million. So if you load your instruments and there is 1 million microorganisms, only one is allowed to survive. I know it sounds strange, but it's a fact. It's a problem. No problem. It's a fact. It's reality. It's the same in hospitals. It's never going to be zero. So this is why the importance of all these first steps, especially pre-disinfection. This is a bit technical. It shows you initial contamination. This is when you put your instruments, you take them from the chair. Okay, 6-log contamination. The first disinfection will drastically reduce the amount of microorganisms, so it participates a lot to the success of sterilization indirectly. So we talk about a reduction of 10 to minus 5 log. Then you clean. By cleaning, it's another 2 or 3 log. You divide by 100 or 1,000 the microbial population. And then 10 to minus 6. This is the last step provided by the sterilizer. And here, inshallah, we have 1 in a million. Yes, this is the theory. So do not underestimate, please, this pre-infection and cleaning phase. Very crucial. Of course, autoclaving is also very crucial. There are many machines on the market. You have these machines from 1880, long time ago, and these new devices. I know in your area, in your country, you still use a lot the dry heat sterilizers. The problem is dry heat, and we talk about the heating time. I remember here when I visited your country that people talk about 100 degrees Celsius for whatever it was, 15-30 minutes. This is not enough. Okay, first of all, the time, this is after preheating. So when we talk about 30 minutes, this is the, let's say, the sterilization phase time, the exposure to heat. And 100 degrees is by far not enough. It must go at least to 180 for half an hour. So we have preheating 15 minutes, half an hour, plus half an hour. Or if you go to 160, it even takes you 2 hours, the plateau. Only in this case you can sterilize, you can kill all microorganisms. To get the same result with steam, you also have a preheating or pre-vacuum and heating phase. Then you work at a much lower temperature, and exposure is only 15 minutes, and only 3 to 6, on our machine Lina it's 4 minutes to get the same result. Now, these are the pros and cons. Dry heat is very cheap, no maintenance, it works as long as you can feel heat. The problem is that you don't have a nice distribution of temperature. You might have up to 5 or 10 degrees difference in temperature, and the cycle times, as you saw before, are quite long. And obviously you cannot sterilize all your instruments. You cannot sterilize handpieces, you cannot sterilize plastic, suction tips, nothing. With steam, the cycles are quite short. It's around 30 to 45, 50 minutes. It can process all instruments. I cannot think of one instrument that you use in the mouth that cannot be processed in a steam sterilizer. Okay, some X-ray sensors, some very specific items, but otherwise you can sterilize plastic, rubber, everything, and you can sterilize them pouched, which you cannot do with a dry heat sterilizer. You cannot pouch because this will again prevent heat from reaching the instrument. The cons, yes, it costs money, but it's quite nice because you use a machine that safeguards and checks her performance or his performance. And you work at high standards. Obviously, running costs, you have to change the door gaskets, what you actually should also do with your dry heat, but you never do it, do you? So you change the door gasket, but it's like 20 euro every 800 cycles, so it's not much. And these machines, our machine does not require any service before 4,000 cycles. This is many years of use before you can service. This is how our MS, we have two machines, MS, let's say we call MS dental and Lina, let's say surgical. This is how it works. The machine will pre-vac the chamber with this air removal system. The only thing is that some hollow instruments may retain some air pockets. So when we talk about surgical units, surgical instruments, maybe you switch to Lina. Lina offers what we call a B-type cycle. This is called B, it comes from big sterilizer. It's actually medical grade sterilization, and it does a very nice pre-vac by running a first vacuum phase. You see the video here. First vacuum phase that removes 90% of air. second vacuum. So we reach, after 3 vacuum and pressure pulses, because this machine mounts a vacuum pump, you have almost 0% air and 99.9 steam. So it guarantees steam penetration in pouched, even double pouched instruments. It guarantees the processing of the most challenging devices, instruments you can use in dental practice. Sorry, it's a bit technical and we have to rush. They also dry very nicely. See, this is absolutely not acceptable. The paper must be absolutely dry and you must not see any droplet on the plastic side. So this is not acceptable. And this is how we would classify the steam sterilizers. These old machines from the previous century are not so, 2 centuries ago, are not so interesting. They have no vacuum, no drying, nothing. So let's focus on B cycle or specific cycle like our MS. You see here, this table shows the different type of instruments. There are actually 6 families, from solid, hollow, and porous. This machine can only do solid, non-pouched. And then you have different examples. Here is our MS machine. It can do solid, of course, up to 2 kilos. All this information must be provided by the manufacturer. 2 kilos is quite nice. You would never process more than 2 or 3 kilos anyway. It can process hollow instruments up to 1 kilo and porous instruments, porous loads, up to half a kilo. So it is a specific machine, specific cycle, but it's much better than the previous ones and much better than dry heat. And here you see the B-type cycle. This is the hospital medical grade cycle. You can process everything. So now your choice could be to switch from your dry heat. You know, in my country it is forbidden because the lack of reliability and the impossibility of processing all the instruments. So it's forbidden in my country and most of the European countries. You may switch to, this is a mistake, you must switch to MS. This machine complies to the American standards, ST55. And this machine, which we call medical, surgical, if you do implants, I would really recommend to go for Lina. I know we equip your markets with some Linas and people are very happy with Lina. Then we store in a very safe and dry area, in a separate room when not so many people will travel around. In this case, you can provide really safe treatments. So this was the presentation. I rushed a bit. I wanted to cut some pictures, but I always struggle to remove some information. So I wanted to give you the best. And as I said, we recorded this video. You can get a copy of the presentation. And now we are open to maybe some chats. I don't know how it works. I switch now on the live YouTube. There's a delay between I see my talk and the live YouTube. I'm happy to reply your eventual questions, which you can address on this email address, christens.stempf@damish.com.